Hello, how are we all? I hope we're all well. If you're new here, my name's Sabrina and I'm a third year medical student at the University of Chicago. I am currently filming this video at the end of March. I'm on my neurology rotation, my last rotation of third year, and neurology is actually pass-fail for us, which means that I have taken all the shelf exams I will ever take in my life, hopefully. And as spring is a time of transition with folks wrapping up one school year and getting ready for the next one, I figured now would be a good time to share some of the tips that I found helpful when studying for the shelf exams. I think some of these tips will also be useful for step 1 and the MCAT, any other exam where you're really studying for a prolonged period of time. But the bulk of my advice here will be focused on the shelf exams, both because I think there's just less guidance out there on how to succeed on the shelf exams, and also because studying while working full-time in the hospital poses a pretty unique challenge. So my first piece of advice has to do with how to pick study resources. The general advice that I've gotten, the rule of thumb that I've used, is to pick one question bank and then 1 to 2 additional resources on top of that. I think it's easy to get overwhelmed with just the sheer number of resources out there that exist. But it's important to realize that, you do have limited time. You are working for most of the day. And so it'll genuinely be impossible to do, every resource under the sun. It's much better to pick a smaller number of resources and to really learn them thoroughly and learn them well and really dive into them, rather than pick a larger number of resources and kind of do bits and pieces here and there. A lot of these resources are designed to prepare you for the shelf exam, so you want to make sure that you are building your knowledge base in every area covered by the resource, rather than just picking and choosing which pieces you want to learn and then maybe having knowledge gaps down the line. So for me, in terms of question banks, for all of the shelves, I used UWorld. It was a resource that I used to study for step 1. It was a platform that I knew well, and it was a resource that my school bought for us. So due to all those factors, it was just kind of the natural choice for me. A number of my friends and classmates also used Amboss and had good experiences using it. I particularly heard that Amboss is good for looking up things on the wards kind of quickly. What I can say is that UWorld worked really well for me. I have no complaints about it. And if you're looking for a non-UWorld resource, I've heard good things about Amboss, even though I have no personal experience using it. So in addition to UWorld, I'm someone who really likes lectures and textbooks. I might be in the minority there, but in general, I really appreciate having those kind of big picture resources that give a broad overview of different concepts and how they fit in and relate to one another. And I feel that textbooks and lectures generally do the trick. So a couple of resources that I would definitely recommend on that front, even if you're maybe not a textbook person, D. Virgilio's For Surgery. It's a super quick, digestible read. It's case-based, so each chapter is based around a specific scenario, makes it a lot easier to follow, easier to understand the algorithms for getting from point A to point B. And at the end of each chapter, there's kind of like a one-pager of quick facts on the specific pathology that chapter covered. I found myself referencing those quick fact pages quite a bit. And in general, I thought the textbook gave a really great overview of the kinds of things that surgeons treat. Another textbook I would recommend is First Aid Psychiatry for the psychiatry clerkship. Also a really fast, digestible read. I particularly appreciated the pharmacology chapter because that is an area of weakness for me. So it was great to get an outline of the different types of medications, pros and cons of each, standout side effects, and what they're typically used for. The textbook also really clearly laid out the DSM-5 diagnostic criteria for each of the kind of psychiatric illnesses, and I found that really helpful and kind of a little bit easier to read through than the actual DSM-5. I did use a textbook for medicine, but I honestly wouldn't recommend it. The field of medicine is so broad, the shelf exam just covers so much material that I think it's kind of hard to find a medicine textbook that covers everything adequately. So if anyone has already taken the medicine shelf and has a textbook that they really recommend, please drop the name down in the comments because the one I used was not it. And before we move on, I want to quickly mention Anki. Anki is definitely a resource that I enjoyed using in second year, that I learned a lot from. So I definitely used it here and there to supplement my knowledge in third year. I think Anki is a really good, quick way to get extra repetition in, particularly when you're in the hospital and you have a little bit of downtime, but it's maybe a little too loud. There's too many distractions for you to really do any practice questions. Anki is a good way to kind of feel like you're doing something with your time. This year I found it more useful as a tool to kind of cement in knowledge that I already learned or gained rather than to learn facts for the first time. But definitely to each their own. I know some people in my class are hardcore Ankiers. I think the long story short of this is just to make sure that you're picking resources that actually make sense with your learning style, and definitely be doing practice questions. So now that you've selected what resources that you're going to be using, I think the single most important thing in studying for the shelf exams is staying organized. It is incredibly challenging to work a 12-hour day and then have to come home and study, and you are not going to feel like it. I promise. You're going to come home and you're just going to want to sleep. And because of that, it becomes more important to give yourself a schedule, to give yourself small daily attainable goals, whether that's 5-year-old questions or Anking for 15 minutes. So on the days that you really don't feel like studying, you can kind of still keep up. So I used an Excel spreadsheet to stay organized. My spreadsheet looked a little like this. This is actually my study schedule for my surgery rotation. If you've watched my planner video, you know that I'm not a naturally very organized person, so this is maybe not the prettiest tool, but I can promise you it's very functional. Just to get ourselves acclimated, I have these columns here that give the day of the week, the date, and what service I was on. So you can see I started with 4 weeks of trauma, then 2 weeks of thoracic, 2 weeks of peds, and 2 weeks of anesthesia. So next I have these columns D, E, and F, which relate to the resources that I chose to use for the surgery rotation. So I have a column for the D. Virgilio textbook chapters, I have a column for the number of UWorld questions I completed in a day, and then I have a column for whether or not I Ankied that day. I also have a note section where I highlight other goals for myself. As you can see, I told myself I wanted to finish all 7 of the trauma chapters by the end of the first week I had on trauma. I also wrote notes to myself on, work that I needed to do for my research projects. Finally, I also have some notes here for annotating answer explanations. So one of the things that I found helpful when doing UWorld was putting all of the useful information from the answer explanations into a Word doc. By the end of this, I had one really big document. As you can see, this is 115 pages of different surgical pathologies organized by body system. And then when I would be doing my reading or doing other practice questions, I would continually add to this document, both to have a document that I could consult when I had questions about things or when I didn't remember things, and also to kind of cement in the information that I was absorbing by writing it down. I made an outline like this for every rotation, and I felt that to be helpful too. So returning to the Excel spreadsheet, probably the most important part of the spreadsheet is the total section over here. I know that the length of rotations varies from school to school. At U Chicago, the length of the medicine and surgery rotations were both 10 weeks long, and all the other ones were 5 weeks long. So, that's a really long time to be studying, and given the fact that you're working full-time during the day, it is really, really easy to fall behind. When setting small, attainable, everyday goals for yourself, it becomes important to know, exactly how many questions you need to do, exactly how many chapters you need to read. When I started the surgery rotation, I had 587 UWorld questions that I wanted to finish. I had all of the D. Virgilio's chapters I wanted to read through, and I had 5 MBME exams that I wanted to do. I ended up only doing 3. I used the Excel spreadsheet to add up all the UWorld questions I had done in this column. I also used the spreadsheet to manually keep track of the number of chapters I had read through. This column shows the percentage of each resource that I've completed. So that way, for example, if I'm at week 5, halfway through a rotation, and maybe I've been on a hard service and not really keeping up with my UWorld, I can quickly glance over and see, okay, I've done only 30% of the UWorld I want to do. That means I have to pick it up. So the last thing I'll say about this Excel spreadsheet is that I like to shade in the little boxes with the color green when I finished all the goals I wanted to complete. So as you can see, on August 31st, I read chapter 46 of D. Virgilio's, I did 10 UWorld, and I Ankied, and I hit all of my study goals for that day, which is a nice little reminder that I was doing well. But as you can also see, there's a lot of white boxes here. I did not finish or hit all of my goals all the time. And, there are days where maybe I wanted to do 20-year-old questions and I only did 10. And that was just another way for me to kind of keep track of how attainable are my goals really. So that is the Excel spreadsheet tool that I made. I lived and died by that thing. I'll put a link down to a blank version of that tool that y'all can download and use if you think it'll be helpful for you as well. So now that we've talked about picking resources and staying on top of those resources, my last piece of advice is to really be present when you're at work and try to absorb as much as possible. I think that oftentimes we think that our study goals and our goals in the hospital are conflicting. And there are times where you're not doing very much in the hospital and you could have maybe done a 20-question UWorld block if you had just been home. Sure, those times definitely exist, but there's also a lot to learn when you're in the hospital. And learning something practically, really seeing a patient who has hypertension, really seeing a patient who has cholecystitis, it can really help cement in those concepts in a way that doing any number of practice questions, any number of Anki cards just can't do. I think third year can be really overwhelming and really stressful in that you have this exam that you have to study for and you're constantly being evaluated by your residents and your attending. But at the end of the day, the point of third year is to experience all the different types of specialties that medicine has to offer, and using that time, using that practical experience to, accomplish some of your study goals can really go a long way. So I would encourage you to really read up on your patients, try to take as much independence as possible when coming up with their treatment plans, ask questions when appropriate. And I've had some really great residents, during periods of downtime, take the time to do didactics and take the time to explain concepts that are particularly tough. And to the extent that it is appropriate, I would definitely encourage you to welcome those sessions, ask people if they'd be willing to talk through something. Ask questions that kind of have come up during your reading or when you've been treating patients. Staying engaged when you're in the hospital is beneficial, not just for your shelf score or for your evaluations, but also for you to really and fully be able to experience third year. Because once you choose a residency and once you specialize, a lot of the time you won't get opportunities like this again to really learn about topics that will not fall into your specialty of choice. So that's all I have for you today. I hope this video was helpful. Please feel free to chime in with study tips, resources that you found helpful in studying for med school exams, whether they're shelf exams or not. And please let me know in the comments if you have any questions, if there's anything else you want to know about third year. Thanks as always for watching, and I will see you guys next time.